It's February, and February is Heart Healthy Month nationally. Today we're going to focus on your heart, keeping it healthy, and know the warning signs. My co-host is Dr. Victoria Uribe. And Victoria, you brought a guest today.
I did. Thank you again for having me. I brought Laura Boyd, who is a family physician at the Elmhurst Addison Center for Health, and she came to help us with the adult issues with heart disease.
Thank you for having me. I am from the northwest side of Chicago. I grew up there and went to school in Chicago. I haven't left. I went to Loyola undergrad, and then I went to Rush University for medical school and did my training at Illinois Masonic. So I've stayed around in the neighborhood. And now I work at the Addison office, and I'm a family practitioner, so I do see kids, but I do see a lot more adolescent and then into adults, up to the elderly. So I'm lucky. I get to see the kids, and I get to see the grandparents along with it.
And isn't that nice? Because yes. You see the kids, the grandparents, the parents. You see the family. The
full family, yes.
Which is what we're going to have to focus on preventing heart disease. And I'm glad to see a good old Chicago girl. So, and thank you for joining us. Well, Dr. Uribe, you are a pediatrician, and so we're going to be working today with both a pediatrician and a general practitioner as you phase your patients from childhood right into adulthood. Right. But I want to start with this fact that kind of boggled my mind. Heart disease is the #1 cause of death in this country. And in 2015, more than 375,000 people died from heart disease. And it's the #1 killer of women today, which totally surprised me because you always hear this cancer or that cancer. It was more deaths to heart disease than any or all combined forms of cancer for women. Surprised me. So I guess we really need to focus on knowing the signs, responding to the signs, and knowing how to prevent heart disease. Right. Victoria, you see young patients, you see them when they're infants. And we were talking earlier, you start monitoring their heart conditions immediately, right. Like on the first visit.
Right. We started a couple years ago, kind of across the country. The recommendations was to start screening newborns for certain heart defects. And so all newborns, after they're about a day old, we actually do pulse ox, check their hands and their feet, and it rules out certain heart defects. And I've had some patients who we do pick up, and they end up getting heart surgery the first week of life.
From just their hands and their feet?
Yep, just checking their pulse ox, their oxygenation.
Really?
It rules out certain heart defects. And then also from the newborn period, we encourage a lot of breastfeeding with our moms, and breastfeeding is definitely a factor that helps to keep kids healthy as far as infections, but also helps prevent obesity, which we'll talk about later, is one of the factors for heart disease later. So from the day one, we're working on good heart health in many ways.
And good health and, okay, breastfeeding, because you're getting the proper nutrition.
Right.
If the mother has proper nutrition.
Right.
So you have to work with both the mother to the baby.
Right, exactly.
And then as they get a little bit older, you kind of, you wean them off of breastfeeding into regular food. And one of the things we were talking about is getting used to eating healthy to begin with, right in the very, very beginning, because that's when you get accustomed to the snack that's a fruit instead of a cookie or a piece of candy or a vegetable, a carrot as a snack. But so often you kind of give the child something sweet.
Right,
Well, sure, they're going to like that.
Right. A lot of parents may not have the best eating habits to start with, but I think when they have their kids, they want to do something good for their kids. So I try to get them to work together and start eating healthier. The kids only know what their parents introduce them to. So if they can start, having their well-rounded meals, much more fruits and vegetables, less of the junk food, low-fat foods as they get older. I also encourage them to eat as a family. People are always on the go and running, and lots of fast food, but trying to plan ahead and have healthy snacks for kids and eat together is a good way to keep everybody as a close family and keep them healthy. The other thing we recommend is just for families to get exercise and get out and move. So if the parents sit around and watch TV all day, the kids do the same. They do whatever their parents do. So we try to get parents to get outside, let's go to the park, let's take a bike ride, get involved in sports, and that's also a great way to keep them healthy and prevent problems later.
It's cost effective.
Right.
You
right.
can go for a walk and just see nature. You can be outside and just playing outside.
Right.
It's healthy for the parents, it's healthy for the children.
Right.
As far as snacks, it's cost effective to buy fruits and vegetables.
Right.
They cost less, they're better for you. And I think parents, once you become a parent, you want to see your child grow up. You want to see your child become an adult. So I think you start thinking about yourself and your own health, so you can watch your child grow. So it's a good thing for the whole family. And when you do things together,
Right.
it's a lot easier to do it together.
Right, exactly, for parents too, to get out and go play because their kids are playing. Right.
You also are watching your child, so you know what your child is doing, what your child is capable of, and they're learning from you as to how to eat well, how to exercise well. And exercise doesn't mean you have to be in a gym exercising.
Right. Right, it's just moving, right? It's taking walks, it's walking the dog, playing catch, the old-fashioned stuff. The other thing that we talk about from day one, and as kids get older, is smoking in the home. So we talk about, is there smoke exposure, which is bad for the kids, lung health, respiratory health, but it also makes parents then hopefully think twice about smoking and trying to get them to stop. So we try to influence the adults in the family too.
Well, you lead by example.
Right, right.
So you're parenting by example more than you are by words, because what they see is what they're learning before they understand the words.
Right.
So
I take care of kids then through high school, typically about 18 or 19, and then from then we move our patients on to the adult physicians, to family practice or internists. So I was going to pass on Dr. Boyd about anything that she wants to talk about as far as maybe heart disease, risk factors and things like that, the things that she talks with her patients about to help prevent problems.
Well, you take them from infancy until 18 or 19 years old, right around there, but you also take them through the sports physicals for high school, for grade school. I think they all need sports physicals today, like even for the younger kids when they're playing baseball or soccer or football.
Right, we encourage kids to come in once a year. So we'd like to do their exams, just check on eating habits, school, exercise, things like that, any injuries. But we also are screening family histories. So we're checking to see if there's any heart disease in the family, any heart arrhythmias. And if there are any risk factors, then we'll actually do EKGs on the patients to make sure that they have no heart problems before they are participating in sports.
Because you see, I've seen in the news, young people, 10, 12, 13, 14 years old, they drop on a field, on a baseball field, at a football field, and a soccer field. They're young.
Right.
And that just boggles my mind that they're so young, and yet it's a condition that could have been noticed or sometimes is noticed.
Right. And not always, you can't pick up all of those things, but there's certain rhythm problems that you can pick up. So we do try to monitor for the risk factors and see if they do need to get EKGs ahead of time.
So when they're young, that's everything starts better when it's young, because it becomes part of your lifestyle.
Right.
So when they're out of your care, you refer them right next door.
Right, exactly, down the hallway.
Right down the hall to Dr. Boyd. Dr. Boyd, you're a family practice. Correct? So you will see them on from the time they leave the pediatrician, or sometimes they don't ever see a pediatrician, but we'll say from the time they leave the pediatrician until
unfortunately death sometimes.
Yes, which is good, because once you get established with a physician, you know them, they know you. Everybody is a little more in a comfort zone.
Yes.
Because you know what's normal for them, you know what's not normal. So it's good to have one physician that you're comfortable with, and it's good for the doctor too, to know the patient. What do we know, or what do we need to know to keep ourselves heart healthy? How do we prevent heart disease? And how do we know? How do we realize that this may be a heart issue? Because heart attacks just don't happen suddenly.
Correct.
I was surprised. I thought, oh, you had a heart attack. That's something you never knew. But in reading, in preparation for this show, I found out that there are a lot of signs and symptoms that I think a lot of us ignore.
Correct. The first thing is really to prevent getting heart disease, you know. So I think the first thing is in the 20s and 30s, really having those physicals and seeing your doctor, going over your future risks and your risk factors that are current so that you can prevent the heart disease in the future. I mean, there's some things that I refer to as controlled risk factors and uncontrolled. You know, the uncontrolled is your age. You know, men over 45 are increased risk, women over 55 are at increased risk. And of course, your family history. It's very important to talk to your parents, grandparents to know, you know, did he have heart attacks starting in his 40s, or did he, you know, first time was in the 70s? You know, sometimes patients will come in and say, oh, my father did have a quadruple bypass, you know, when he was 70, but oh yeah, he did have a heart attack in his 40s. And those are really important things to know, because then it gives you an idea of how much you need to be paying attention to your own health. The things that you can control, the risk factors, are smoking, number one. Every patient, you know, the minute we know they're a smoker, we really encourage them to quit, help them, give them the tools to quit, offer them, you know, there are medications, there are counseling sessions, and really encouraging them that this is a huge risk factor for their future heart health, to quit smoking. And then cholesterol, important to know your numbers, to ask, to get checked on a regular basis. Depending on your risk, you know, it might be in the 20s and 30s, you do it every 5 years if your numbers look great and you're in good health. But as you get older and your risk goes up just because of age, then you should be getting it checked more often. And then, of course, obesity and lack of exercise, as Dr. Uribe was mentioning. Really, the foods, your diet, your lifestyle makes a huge difference, and it's something that we talk to our patients often about, and that's the whole point of the physicals, to come in and just kind of find out, okay, what are you doing on a regular basis? What's your activity level? Are you going to do regular exercise, or are you spending your evenings, you know, on the couch, as Dr. Uribe was mentioning? And then talking about the signs to know if you potentially have heart disease, you know, before you have a heart attack. That's really the point of it, is to prevent a full heart attack. You know, some signs can be just subtle, a little bit more shortness of breath going up a flight of stairs, or not being able to walk that extra block anymore, or having a little bit of chest pain, but it goes away most of the time, so you kind of ignore it. You can have a little bit of radiating up the jaw, up the neck and into the jaw, or radiating down the left arm, but it goes away, so you don't mention it. But those are things you really need to be mentioning to your doctor and seeking help. And of course, if something comes on suddenly, like a sudden shortness of breath, chest pain, elephant, pressure on the chest, radiating up to the jaw, left arm pain, vomiting, cold sweats, go straight to the ER. You know, you should be calling 911 if you're at home by yourself.
And when you say numbers, and not just the cholesterol numbers, your blood pressure numbers and your BMI, body mass index.
Yes.
Now, you can get that from your doctor.
Correct.
And you should watch that yourself too, because that's body mass, isn't that fat to muscle or something like that? I don't understand it totally.
It's a ratio based on your height to weight. So there's BMIs, you know, we look at the numbers, we want you like less in the range of less than 20, 21, then there's different levels of obesity and then morbid obesity. So, you know, and that's actually something you could do at home too. If you know your height and you know your weight, there's, you know, you can Google anything and you could find a BMI calculator, and you could figure that out and see what range you are, if you are within the range that you should be based on your height. And it's based also on men versus women. Sometimes you'll get better calculators that can distinguish the ratio based on that.
And you can get those numbers down by physical exercise,
Oh,
or
of
just
course.
physical activity, really.
Yes,
I mean,
yes.
everybody thinks exercise, it's hard work. Not necessarily.
Yes.
If you're at work, walk the flight of stairs instead of take the elevator. Park at the furthest parking spot and walk. Maybe not in February because it's pretty snowy and pretty cold and you don't want to slip and fall, but
Yeah.
these are just little things that you can do.
We also, as for kids, we do BMIs starting young, and so we have growth charts for kids as they're growing up, and it has calculated on our computers what their BMI is. So we're talking to patients young about what their BMI is.
See,
and
that's
trying to
good
keep it
because that's
low.
what they grow up with. This is
Right.
how you learn. You learn the best when you're young.
Right.
And then you just kind of take that with you as this is what you do, you know.
Correct.
I've had a number of questions that people have asked me to ask about myths or fact. What about an aspirin therapy? People take an aspirin a day. Is that good for everyone? Is there a reason?
That's something you should, it's an individual basis. You really should talk to your doctor about whether you should be taking a baby aspirin. Certain patients, certainly diabetics, after a certain age, we recommend that they start on a baby aspirin to decrease their risk for heart disease. But there's also patients that we don't want taking baby aspirins that maybe have gastritis, or they have a history, which is inflammation of the stomach lining, or if they have a history of what we refer to as a GI bleed, meaning that they had a bleed in their stomach or in their colon, then we say, we don't want you taking that baby aspirin. So it's something to talk on an individual basis with your physician if, given your age and your risk factors for heart disease, if it's something that you should start taking.
Well, you're saying baby aspirin. What about the low dose aspirin? Is that?
That's the same.
It's
yes,
the same
81
thing.
milligrams. Yes.
Okay, that's the same thing. The other question that was asked of me is vitamin K. Leafy green vegetables, which everybody thinks is supposed to be very good for you, but some people are told they can't have an excessive amount of vitamin K. Why?
That is usually in reference to patients that are on blood thinners. That might be, there's medications that patients take on a regular basis, and the specific one in relation to vitamin K is usually Coumadin, and that's been around for a long time, and some patients are told to be on it after they've had a stent placed, or sometimes after they've had significant heart disease or arrhythmias. Often when people have atrial fibrillation, they're told to go on Coumadin, and vitamin K can actually reverse the effects of Coumadin, so it can make the blood thicker, and the whole point of the blood thinner is to make it thinner. So vitamin K is completely fine for anyone that's healthy and not on these medications. You should be eating them. They're good for your health. They're great for your body. We want you eating them. It's only for those specific patients. So really it's something to, once again, talk to your physician about, because it's on an individual basis.
It's more counteracting medication.
Correct.
So
that specific medication.
That specific medication. Now, stress. Stress causes or can cause heart attacks or heart disease. If you control your stress, can you control having, if you've had a heart attack because of stress, can you not have a heart attack if you control your stress?
It would help, but there's also other risks, other issues that are at play sometimes for that. But certainly controlling your stress is a big factor for heart disease, because when your body is stressed, it increases the stress hormone cortisol, which increases inflammation in the coronary arteries, which makes it a little bit more possible to have like a plaque get loose and have blockage and have a heart attack. But there's other factors in play if someone has high blood pressure, of course, and smoking, and
heart attack or a stroke.
Correct.
And you can reduce your stress by, they say, meditation, yoga. I say just sit down and relax. And it's not easy to do. Mm-hmm. It's very easy to say. It's not easy to do, but sometimes you need to just put yourself in, I call it a church mode,
yes.
where you just sit down and empty your mind for just a few minutes, mm-hmm. and breathe deeply, and it seems to work.
And exercise to de-stress.
And exercise.
Mm-hmm. That's what we want to throw in there every time.
Mm-hmm. And that does de-stress. Mm-hmm. And you don't realize it does because you're working it, but you're not thinking about the things that cause the stress. You're thinking about getting this finished.
Correct. Yes.
And one of the other questions, and very quickly, some people, as soon as they hear they have heart disease, they want to run to a teaching hospital. You're from a teaching hospital. Did you notice that? And is there a reason? Why do people run to teaching hospitals?
I guess, well, the teaching hospital would be referring to more like, what we say, tertiary care type, like academic. So like for in Chicago area, that'd be like Loyola, University of Chicago, Northwestern. Mm-hmm. That would be the big rush.
Right, rush.
So, sometimes people think that they're going to get the best of the best if they go there. But really, you should be going to especially an emergency, if you're having a heart attack, you need to go to your closest hospital. And all hospitals, community hospitals included, they all deal with heart disease. They all do, angioplasty, they do stents, they do bypasses. It's not something you need to go to a tertiary care center to receive good care for.
See, and that's what I've always felt. You're traveling, you're creating stress getting to these places,
yes.
When you can probably seek out somebody who's as good, if not better.
Correct.
closer and more convenient, because when it's a heart condition, you don't want to waste time.
Correct.
Time is of the essence.
And sometimes when after you've had a heart attack or if you've had bypass, they want you to do cardiac rehab, and you want to do that close to home. You don't want to be traveling often, and that's the type of thing you go in regularly and do exercise, and it's monitored. And so you want that to be part of the hospital that you're getting care at.
Yeah, otherwise you're just not going to do it.
Correct.
Or you stop doing it because
Yes.
it's too inconvenient, you know. Well, we've got a few minutes left. I just want to talk a little bit about what we should know, again, repeat it, what we should look for in knowing whether we're having a heart attack or heart disease symptoms, and then prevention. We've got to start learning to take care of ourselves. So, doctors, what do we do?
Well, I think for as far as kids and families, one thing that we use a lot is something called 5-4-3-2-1, easy for people to remember. So it's recommending 5 fruits and vegetables every day, which is difficult for most people, but if you start counting, you can do it. 4 glasses of water a day, 3 servings of calcium, whether it's milk, yogurt, or cheese, limiting to 2 hours of screen time, which is virtually impossible with our kids these days, but non-learning things, but as far as staring at the TV, video games, things like that, try and limit that time, partly because you're just sitting there, you're snacking, and you're not exercising. So lots of reasons not to do too much TV time, and then the 1 hour of exercise every day. So if you kind of set those as your goals each day, it's a good way to prevent a lot of heart problems in the future, obesity, and just help you be a healthy family.
It also increases your energy. When you say exercise, it actually increases your energy, but it doesn't have to be actual gym type of exercise. Walking is a good exercise.
Right. Walking your dog, right. Just playing outside.
Playing is a very good exercise.
Yeah, exactly.
And what are the signs that we really have to look for, especially as you get older? Yes, you have to look for them in young people, but especially as you age, what are the signs that we should look for and beware of?
I think, once again, kind of looking for the signs that may be leading to a heart attack, so having a little bit of chest pain, maybe a little heartburn sensations, or having that little bit more of a shortness of breath, or feeling like you're sweating, or like your heart is racing a little bit more when you're doing regular activities, or having kind of unusual jaw pain or anything like that that's new for you, or even that's been happening for a long time. You should always go see your doctor, kind of mention these things, and then with knowing what your risk factors are, if you're hypertensive, if you have diabetes, if you have a family history, your age, they might look a little bit further to see, hey, is there something impending here? Is there some blockage that needs to be taken care of? And of course, sign of an acute heart attack, that sudden pressure, chest pain, radiating to the jaw, left arm pain, sweating, nausea, vomiting, those should be 911, go to the ER.
So do tell your doctor all the things that you feel are a little different, especially as you get older.
Correct.
Things change, and I used to be able to walk a mile in less time, but life changes. It might be normal, there might be something going on. So thank you both for joining us. We want everybody to keep your heart healthy, and thank you for joining us. I'm Lucille Zucchero with Dr. Uribe and Dr. Boyd, and here's to your health.